Welcome back to What You Need to Know. GMA3, Dr. Jen Ashton here talking about something that we think of when we think of children, ADHD, right? But this is something that can carry over and often does through adulthood.
Through adulthood, and a new study published in the American Journal of Psychiatry actually looked at people for about 16 years. Unfortunately, they stopped it at age 25, but it gives us a glimmer, an insight into the fact that this is not just a childhood condition, because 90% of children in this particular study did follow with symptoms into early adulthood. And we were saying in the commercial break, I see a lot of this in women who, as they get close to menopause, they start to have a lot of symptoms. They think they're all related to menopause. And upon further questioning, you know, as we're trained to do in medicine, it really is that they've had undiagnosed ADD or ADHD. And so they're dealing with a couple of things at the same time. And, you know, we were talking about, we know adults who clearly show signs and symptoms of it, but they're adults now. Remember, when we were teenagers, this still existed. It's just that it wasn't on our radar. We weren't able to test for it. The screening criteria weren't the same. So many people were forced to compensate and go without recognition, without treatment into their adulthood. And it can affect, you know, your ability to hold a job, to continue a relationship, to do everyday tasks. And people are just so used to compensating, right? They don't think about it.
Right. It didn't necessarily have a name back then, and it's not something you necessarily grow out of, as I think a lot of people thought. I know that there are drugs out there to try and help mitigate some of the, you know, symptoms, but
it really depends on the individual person and how it's impacting their life. But as we always talk about, the key is awareness.
Yes, knowledge is certainly
That's right.
All right, we'll be right back. Thanks for joining us.